Hi, my name is Kyra McCoy, and I'm the director of the Practical Nursing Program at Edmonds College. This presentation will give you information about the requirements for students to go to clinical. Fall Quarter 2023 marked the 10th anniversary of the Practical Nursing or PN program at Edmonds. The program is designed for students who are currently working in healthcare. The Edmonds College PN program mission is to educate nurses from diverse backgrounds who are caring, technically competent, technologically literate, culturally competent, and who are prepared to practice with commitment and integrity in diverse and changing healthcare settings. There is also a video available with general program information on our webpage, so check that out too. The state of Washington requires at least 300 hours of clinical experience to graduate and become a licensed practical nurse or an LPN in Washington. In order for students to complete the hours needed, they have to complete the requirements discussed in this video. We often refer to these as a clinical passport or your ticket to go to clinical. General categories of documentation needed for clinical placement include national and state background checks, documentation of immunizations, TB status, CPR, and a urine drug screen. Requirements to care for people in healthcare settings are imposed by state law and policies of individual facilities. We have no control over this. We use a service called Castle Branch for students to upload and store documents related to their clinical passport. Students receive instructions on how to get an account with Castle Branch upon admission. There is no need to purchase an account prior to that time. However, it is a good idea to get started on your requirements before then, since in order to remain in the program, we must have all documentation complete by the first week of the quarter. Some of the immunizations can take almost 8 months to complete, so an early start is highly recommended. When a student signs up for an account at Castle Branch, the company completes all the required background checks. Nurses care for vulnerable populations, and the state has to ensure that our students do not have a record of anything that could put the patients at risk. There is a list of DSHS disqualifying crimes on our webpage. If you have anything on your record that is on that list, it may keep you out of nursing school, so please check this out if that is a possibility. Skilled nursing facilities also require a DSHS background check, and that not only covers convictions, but charges and other things like CPS reports. Clinical sites can deny placement based on their own criteria, and again, the school has no control over this. So if you have anything on your background check, please disclose it so that we can work with you. You must have documentation that you do not have TB. This is most often done with a skin test, also called a PPD. You must have documentation of your initial 2-step PPD and then documentation of your annual follow-up tests. If you don't have this, you will need a 2-step test to begin with. This takes 2 to 3 weeks to complete. If you were not born in the U.S. and had BCG, which is a TB vaccine, as a child, you should not have a skin test. You have 2 alternatives. Submit a clear chest X-ray report or a negative quantiferon gold blood test. TB status is updated annually, so you either have to have another skin test or a blood test for the second year of the program. Students are required to be immune to certain communicable diseases to protect the patients they care for. Those are listed on this slide. For hepatitis B, it is as much for the students' protection as it is for the patients. This vaccine series takes 3 injections over a 6-month period, and then a blood draw for an antibody titer 6 to 8 weeks after the last vaccine administration. So this is 3 vaccines and a positive antibody titer. For varicella, which is chickenpox, measles, mumps, and rubella, students also need proof of either 2 vaccines or a positive titer. Students must have an influenza vaccine annually every fall, so you will need 2 flu shots during the program. Students should also be immunized for COVID-19. Many of our clinical partners require students to have the COVID vaccine, and some even require boosters. There are facilities that will accept a waiver for medical or religious reasons, but many don't. School has no control over this. If you are not vaccinated, we may not be able to place you at a clinical site. If you do not complete the 300 hours of clinical time required by state law, you will not be eligible to graduate or to get a license. We want you to make an informed decision before you start the program. All students are required to be certified in CPR. We require American Heart Association Basic Life Support, or BLS. We will accept a certificate from your job if it is American Heart Association BLS. Courses are also offered at the college and are available locally. You cannot take a fully online CPR course that meets these requirements. CPR certification lasts for 2 years. At least one of our clinical partners requires a negative drug screen. Even if a drug is legal in the state of Washington, like cannabis, a positive drug screen will prohibit you from attending clinical. Some prescription medications, such as ADHD medications, anti-anxiety drugs, or antidepressants, will also show up on the urine drug screen. If you take these medications, you can provide documentation of a valid prescription and you will be fine. The best way to contact us is by email. If you have questions, there's much more information about the program, including other videos, frequently asked questions, and an application on our webpage. You can also contact our program support staff. Our nursing navigator is Julia Erickson, and our administrative staff is also listed above. Please understand that the information in this video is a requirement for completing this nursing program or any other nursing program in the state. We have very little, if any, ability to make exceptions. Thank you for your interest in our Edmonds College Practical Nursing Program. I hope the information in this presentation was useful, and I look forward to receiving your application soon.